I'm a PhD student, a candidate, and this research is from my first study of my PhD. So compared to women, men's health outcomes are not in very good shape. Men are dying younger, most likely from something that's preventable. They have less healthy years. And despite Medicare services in Australia, I'm talking about men in Australia, Medicare services being available in Australia, they hardly use them. In fact, in this these stats from 2017 show that in the age groups from 15 to 44, men had usage of Medicare services per capita half the usage to women. Now sure, women in this age group are in their reproductive years and are warranted, that they're going to have more claims than men, but given the disparity in men's health outcomes, we need to get men using health services more. That's what I'm about. So why aren't they using them? Well, in much literature, the threat to the masculine identity is being cited as a big barrier, one of the main barriers. Masculinity, the recent work, like in this, the last 20 years or so, says that men endorse different masculinities. Like it's just not one overarching masculinity, but they all refer through norms and ideals back to the traditional masculinity. This is in more recent literature. And that is usually bad for health behaviours and health outcomes. But interesting, what about the current generations, the new generations of men coming up? Do they still endorse the traditional masculinity? Some recent studies in North America and Canada suggest that there is a shift in men's health-related masculine ideals and masculine norms. But we don't know what the go is in Australia. What about Australian men? Are they still influenced by traditional norms, or is there a shift for the younger generations of Australian men? In marketing, social generations is a really useful tool to understand different consumers in similar age groups, such as baby boomers, Generation X, Gen Y, also known as Millennials, and Generation Z. Because in the social generations, if you're a member of a social generation, you share the same social influences, such as your political or popular culture influences, health influences, technology. These are the things that shape you in your growing years, along with your fellow people in your generation. So it's not unreasonable to think that if things change as generations move along, that the idea of what it means to be a man, or gender, what it means to be a woman as well, changes as generations change. So it's not unusual, it's not bizarre to think that there might be some changes in what it means to be a man. But we still have this problem here. Men are dying still younger than women, even though they have access to preventative health services. And so the research we have two questions that we've asked. One is about conformity, overall conformity. Does that, to traditional masculine norms, does that affect men's access, male consumers accessing health services? The next is about specific masculine norms. Does that have a role to play in men's likelihood of regularly accessing services? So this research is a secondary study of analysis of panel data from the 10 to Men study on, it's a longitudinal study on male health, and it's still going, and males aged from 10 to 55 were in the whole sample. This study, my study, used males from 15 to 55 because they were asked questions about masculinity. Only those surveys were asked questions about masculinity, and that was the first wave of data collection, and just under 15,000 participants. And also it covers 4 social generations. So yes, and we can measure masculinity. These are the type of measures. So first thing we did was we compared, looked at scores for overall masculinity. So there were scores that were overall masculinity, conforming to overall masculinity, to compare the generations. And this is what we found, that the younger generations in Australia, of Australian males in this sample, and the sample was over 15,000, have higher conformity to traditional masculinity. Their scores were higher conformity to traditional masculine ideals than the older generations, which is contrary to what recent literature from overseas is suggesting the trend is. Then to support this, we drilled down to the actual norms that were asked about, the factors in the instrument that was measuring masculinity. Each factor, 11 factors, represented 11 norms, traditional masculine norms. And as you can see, that the highest scores for those, mean scores for those norms, came through the younger generations. So yeah, they had the highest scores. Generation Z had highest scores for conformity for most masculine norms. X had one at 128, and that is actually, if it's out of 6, so these scores are out of 6, so the bench, midway is 3. Under 3 is really actually regarded as non-conformity, and baby boomers had no highest scores. So what happens when we bring health into the mix? First of all, we looked back to overall conformity, and does it have a role in the relationship, has a mediating role in the relationship with social generation and health service use. We were able to look at 2 different types of health service. We could look at preventative health service and primary health service through the variables that we had in the data. And so, not really. Overall masculinity doesn't really have much of an effect. It has a non-significant effect on the relationship between social generation and primary health service use, and it has a significant but small 0.005. That's a very small effect, on a negative effect on the relationship to using preventative health. But what about the specific masculine norms? 2 different health service types, primary and preventative. And first we looked at all the generations and did a logistic regression, adjusted logistic regression, weighted for the Australian population, and it was adjusted, control variables for health and socio demographics, were controlled for those things that might have an influence on health service use. So there's quite a few. And still we had significant, and we used the specific masculine norms. The black is, conformity to these masculine norms will have a negative effect on regular use of a primary health service, and green is, it will have a positive effect on primary health services. Only dominance is green in primary health, but if we look at preventative health, there's a few more green influences there, meaning few more norms that if you're conforming to that norm, that you might have a high likelihood of regularly using preventative health services. Interesting, just take a note that in work and school is green for preventative health, positive influence, negative in primary health, negative influence. Also within the generations for preventative health, risk-taking is positive influence for Gen Z and negative for baby boomers. Gen Z in that sample for preventative health, I should just put a caveat there, was a smaller sample for that variable because the younger generation, the younger participants weren't asked the preventative health question. So what are the implications? Yep, traditional masculinity remains relevant for younger generations of Australian males, but specific dimensions of masculinity are better at predicting regular health service use, and the predictive role of some norms It's highly contextual, given the duality of the positive, negative. And implications for practitioners: use messaging that appeals, leverage specific masculine norms, winning, language that are the norms that are going to have a positive influence. Better still, be targeted to your generation and use positive norms for that generation. Use the norms for that generation. And use the power of status, the power of organic social media, using influencers, male influencers, to push positive health messages. Thank you and good night.